Thank you, Emma. Thank you all for coming this morning. It's wonderful to be here. Moving on to the business at hand, mental health, which is a pretty heavy topic, and agree with a lot of what my colleagues up here have shared with us this morning. Again, coming from EML being claims manager, I wanted to focus in on the claims management section of the green paper and some of those recommendations. And more specific, those key recommendations around those specialised skills and some of the things that we've done, and share some examples to try and improve in that space. And really that whole notion around trying to avoid doing further harm. So the processes are, and you'll come to see this as I go through my presentation this morning, really complex, especially for some of the people we deal with, some really high risk people who are quite unwell, and the processes are really arduous for even people who are out there working in the industry, let alone people who have mental health conditions and have not been exposed to the insurance processes before. I'll also touch on something that Jeff mentioned earlier about that data gap, and I think that's been consistent through here, about the data gap between diagnosis and claims outcomes, and how do we know that we're on the right track when we're trying to make a difference in this space. As Emma said, my background's predominantly in the police emergency services portfolio, so I've spent 12 years working with police directly until early this year joining EML. And this year I've been focusing in the former officers, so detached workers, and this is the portfolio I wanted to talk about this morning and share an example with you all. So looking at this portfolio, 2,500 roughly former officers, so they're no longer employed by New South Wales Police, they're job detached. The police force continues to, unfortunately, have been necessary to discharge 20 officers thereabouts every month. So there's 20 New South Wales police officers leaving the force every month due to injury because they can't complete the inherent requirements of their role descriptions. They're nearly all mental health injuries, so over 90% of those people coming across into this portfolio have mental health injuries, predominantly PTSD, but as the paper mentions, there's a lot of comorbidity around that. So rarely do we see just a PTSD claim, there's usually anxiety, depression, substance misuse as well. 65% are aged between 30 and 50, so there's still a lot of working years left for these people until they reach retirement age. But 68% reside outside of the metropolitan areas, so when we're talking about getting people who are no longer gainfully employed into new employment, we're dealing with kind of those weaker labour markets. Most cops get paid the same in the country as they do in the city, but the cost of living is a lot higher in the city, so it's pretty desirable for them to move to those country locations. And when they become job detached, we're working in those labour markets. They also have quite high probable earnings, so police officers are paid pretty well. So we're talking about trying to get people with mental health injuries living in some of the weaker labour markets across the state, jobs that are paying up to and over $100,000 a year adds another level of complexity. This I thought would be really interesting to the people in here who aren't aware of this, but for New South Wales police officers, most of these people have concurrent income protection claims. So they have a group policy through First State Super and TAL administer that. So these people are not only on workers' comp with us at EML, but they also, by the time they become job detached, they've served their 9-month waiting period and they're on income protection. So they're not only dealing with our processes and workers' compensation, they're also dealing with the income protection claim as well, which is topping them up to 75% of their pre-injury earnings. Which is good and bad. That benefit period is 7 years, and we're kind of, since that policy came in 2012, we're kind of at the crux point now is to see what that changes in their experience with regards to people coming off that benefit period, but they're still on claim with us at EML and workers' compensation. So that adds another layer of complexity. So given all that, obviously it's a big driver of the liabilities and the risk and the cost to the premium for this cohort. But probably more importantly, these people are really high risk in terms of their health and social outcomes, impact on their family, impact on the community. As I said, those comorbidities make it a really complex issue to tackle. So some years ago now, we knew that, given all understanding that risk profile, that we wanted to do something in this space. We wanted to improve outcomes for those people and for the scheme. So we engaged the customer experience company to come in and do some qualitative research and really help us to understand what goes on for these people and how we can improve our service and support of them in this time. So they undertook a qualitative study which involved them going out and meeting with, interviewing, getting the perspective of former officers who had been through this process, mapping out the pain points in the claims journey, what worked, what didn't, how that felt at certain times. They consulted with families, treatment practitioners, and then support staff, so case managers with EML, people in New South Wales Police and their support organisations in the workplace, to really get a really good understanding of what that journey looked like, what were the issues, and specifically where were the opportunities for us to improve that and work together. They developed some personas which have become really excellent tools for us, and things that we've implemented across different business units at EML in terms of really understanding our customers' needs, what that looks like, and being able to bring that to the forefront of our frontline support staff's mind, so that we make sure our services are fit for their needs. So what we learned from that, and one of the key recommendations from the CEC thing, was the framework and the process in which we were using was relatively suitable for people with physical injuries, and they could fumble their way through the process and systems, and they would be okay with that. They could find their way through, but it largely wasn't effective and helpful and supportive for people with mental health injuries. So given my previous slide about how complex this issue is, and they're dealing with a lot of things going on, issues at home, financial issues, stress, loss of role, the processes and frameworks in which they were forced to undertake were largely not effective. And so one of the recommendations was we should redesign and rethink about how we delivered our services specific to those people's needs. So what we did was we undertook to redesign everything in partnership with New South Wales Police about how we supported these people, and we called it the psychological framework. So really we looked at how we did everything and interacted with these people, the service offerings from New South Wales Police internally on their journey right throughout their claim, and then obviously that crossover with EML and our claims staff, and then ongoing after they were discharged and left New South Wales Police Force. And this is a really high overview, but you see it was broken down into that early support, sustaining a return to work, and then supporting independence when they became job detached. But one thing that came to mind throughout this was that it didn't need large-scale changes. There were some recommendations we could do quite quickly and easily and low budget, and make just tweaks to the way we did things. So things like changing the wording and letters that we sent out, stripping out duplication. So rather than in the first 3 days of a claim, they're getting contacted by a case manager at EML, asking all the 3-point contacts and the compliance questions about the claim, and then the people from police asking those same questions. How do we just have one person capture that key information, share it across, and the other person can just confirm what their role is and how they can go about supporting that person? So really little simple tweaks that you may or may not be doing, but we found there was a lot of little things made a big difference. And probably the biggest thing, because to do this we did a lot of workshops with our people, with New South Wales Police, with workers, and that was really key to all this. We used a human-centred design approach to make sure that everything that we did was fit for them. So we asked them throughout. So we came up with different options. We sent them forms. We asked them to red pen it. We redesigned before we implemented to make sure that it was meeting their needs along the way. But perhaps the biggest impact we had throughout this process was the impact on the mindset it had on the support staff. So with them being involved in that design process throughout, their mindset shifted from just doing the things that they always did and following the bouncing ball and the process throughout, to really focusing on what that impact was for the individuals. So really shifting the mindset from process to person centred, and really understanding that little things can make a big difference. That was really powerful and empowering for the people, that them knowing that they don't have to solve all the problems for that person, but that one interaction or that one thing they did for them, making a phone call and getting them an earlier appointment, or asking how their family was and offering some support in that space, really went a long way to improving their experience. So we rolled this out and implemented this kind of late last year, October, November, and we're really pleased to date. So from February through to September this year, we've seen a 27% point improvement in our Net Promoter Score with regards to employees with psychological injuries. And so that's what we set out to do at the start. We knew the NPS would be a key measure for us. We wanted to improve the experience of these people, and we wanted to ensure as much as possible that we could minimise any potential further harm for these people who are already doing it pretty tough in a pretty sticky situation. So in terms of what Jeff said, I completely agree that it's hard to understand completely because there's so many moving parts to mental health claims, and especially complexity such as what we see in this portfolio. It's hard to understand if you're running multiple initiatives at one time, which one's having the effect, especially on that long-term claims data. But we're really happy that this has seen a drastic improvement in their experience, and we want to continue to build on that. However, it's too early to determine how that's going to play out in terms of claims outcomes. So we're taking people who are not employed with mental health injuries with complex needs. We're kind of not yet 12 months in, so we're hoping and we're confident that this will see some improvements, but that measurement around the effectiveness of specific initiatives is most definitely an ongoing challenge. So just to wrap up, a couple of key points for you guys, hopefully to take away. Executing in these mental health workplace initiatives is really difficult. You will fail often, and it's really hard. You will come up against a lot of challenges that you need to work around, so you need to really stick with it, but it's most definitely worthwhile, and we need to continue on with that because the risk of doing nothing far outweighs the risk of failure. I think some of my colleagues up here have alluded to, I think, absolutely coming from an employer perspective, I think we've all got a role to play, and the insurance sector is definitely, I think, in many cases leading the way in this stuff, and we control what we can control and trying to do what we can do to support these people. However, the biggest improvements are going to come from our ability to influence employers to do that, to take better care of their people and better support them when they are injured in mental health. Absolutely have been exposed to a lot of injured police officers in this space. They appreciate the effort that others make, but what they really want is the organisation to take care of them. They want to hear from their bosses, their colleagues and people within, and they want to know that they're being taken care of as part of that family. As I mentioned, there is a data gap between the claims lodgement, the diagnosis, and the claims and the outcomes. So what I mean by that is, we know how many claims go in, and that's somewhat of an indicator of how well we're doing in this space. I won't go into the diagnosis issues, and there are definitely issues around diagnosis and getting the right diagnosis, leading into the right treatment in this space, and there's areas for improvement there also. But what I'd love to see, and I think there's a definite gap in the market, is how do you take reports from symptomology, from treatment providers and claims outcomes, but understand that the interventions, whether it's clinical treatment or workplace interventions, and know that we're improving function for these people. So there's a real big gap there. You're not going to take an officer who is job detached, who has complex mental health issues, comorbidity, family breakdowns, and you won't see claim outcome there for 2 years potentially. But in that time, how do you know that what we're doing is on the right track? How do we know that the treatment's being effective? How do we know that their quality of life is improving? Because they're so far away from actually securing employment, we need to be taking small steps to be able to get them functioning at home, to thinking about new work, to start job seeking, and hopefully improving their quality of life. Lastly, if you're a practitioner in this space, it is hard, persevere. We need to be trying different things. We need to innovate. As I said, not everything will work. But if you're turning up every day trying to make a difference and implement change in this space, you're doing a great job already. You need to stay at it. We all need that. And if you're a leader, position of influence, if you're the person crunching the numbers and the data and monitoring performance and improvements in this space, trust that and support your people that are trying to implement and do things in this space. It's really important that you help them, because we are on the right track, but there's a long way to go. And commit and be patient, because results, and especially if we look at those claim outcomes, it's going to take a long time. This is a complex issue we're dealing with. If you've got some lead indicators that indicate that things are going well, stay the course, be patient, and the results will come. Thank you very much.